I'm Dr Ravi Huilgol, vascular surgeon at St Vincent's Private Hospital, Sydney. Well, diabetes is all too common, unfortunately, and in Australia, over the first 15 years of this century, we've seen a tripling in the rate of diabetes in the community. There are many more people who are either pre-diabetic or that is on their way to diabetes, or have diabetes and don't know about it. Diabetes also affects the population more as we get older, and there are more people over the age of 65 than ever before in Australia, and these people have a rate of diabetes of about 16%. So diabetes causes problems with the way that nerves function and the way that vessels function. Nerves are vital to the way the body functions because it transmits electrical impulse from the brain to everywhere basically, and includes the transmission of the way things feel and the way things move. Vessel function is important because it takes oxygenated blood to where it's needed. The vessels, or the organs that are affected by this underlying problem that diabetes causes include the brain, the kidneys, the eyes, and the blood supply to the heart and legs and vital organs. Diabetes is a serious problem and affects the way that the legs function very badly. Not only does it double the risk of blocked arteries in the legs, but it also affects the way that the legs and feet can respond to infection. It affects people's ability to feel injury that occurs to the toes in particular and the foot, and it affects the way that the skin is too dry, and that you have increased risk of the foot becoming deformed in diabetes. And the flow and effects from all of these issues, poor sensation, poor blood supply, poor infection response and deformity of the foot, is that we have increased chance of infection and tissue loss in the foot, and sometimes that can be a threat to the survival of the leg. The type of diabetes that we have the most ability to influence and is the biggest problem for us in the community is type 2 diabetes. And type 2 diabetes occurs more commonly in people who are overweight and people who are inactive and who have a poor diet. And therefore the focus of prevention is really about maintaining weight in a healthy range, maintaining a healthy diet and being active. There is some research looking at whether or not the way that the gut functions, in particular the gut microbiome, has an influence on the development of diabetes, but at the moment the mainstays of diabetic prevention, type 2 diabetic prevention, is maintaining an active, healthy lifestyle and a good diet.